This is breaking news from the Las Vegas Review-Journal, sponsored by Michael Gaughan's South Point Hotel, Casino, and Spa.
One question from each member of the media, and follow-up questions may be emailed to the Office of Communications. We will not have a Spanish language portion of today's briefing. You have our permission to record if you're able to do so, and we will have a copy of the recording available upon request. On today's panel, we have Joanne Rupiper, Director of Clinical Services here at the Health District, Dr. Court Loaf, Acting Chief Medical Officer here at the Health District, and Chief Greg Castle, Incident Commander for our Incident Management Team. We will now begin with Chief Castle. Thank you.
Good afternoon, everybody. I'm going to read you some statistics and information, and then I will introduce the rest of the panel. So as of March 3rd, 2021, there have been 489,600 COVID-19 vaccines administered in Clark County. 325,120 of those are first dose, 164,480 are second doses. Eligibility was expanded this week to include all the remaining categories in the frontline community support group and to the frontline supply chain and logistics group. In addition to people in these occupation categories, groups currently eligible to receive vaccine include people 65 years of age and older, healthcare workers, and those in public safety and security frontline group. Beginning next Tuesday, hours of operation will be expanded at Health District COVID-19 vaccination sites. The Health District's 280 Decatur Clinic reserves appointments for people 70 years of age and older and those with mobility issues. This clinic will now have appointments starting at 7 a.m. The Las Vegas Convention Center site and Cashman Center hours of operations will also expand, with the last appointments now available at 5:30 for the Convention Center and 6 p.m. for the Cashman site. They both begin at 8 o'clock in the morning. The Southern Nevada Health District has not received its first shipment of the Janssen vaccine. This is the one that's known as being called the Johnson & Johnson. It's important to note that Janssen is the pharmaceutical company manufacturing the vaccine and is owned by Johnson & Johnson. When people begin receiving this vaccine, their vaccine card will read Janssen and not Johnson & Johnson. The Health District will refer to the vaccine as Janssen following guidance from the Centers for Disease Control and Prevention and the Food and Drug Administration. For the sites of current Health District and partner clinics, visit our website at www.snhd.info/COVID. And now I'd like to introduce Dr. Court Loaf, Acting Chief Medical Officer, and Jennifer Rupiper, Chief Administrative Nurse from the Southern Nevada Health District.
Thank you, Chief Castle, and good afternoon, everybody. I'm going to first direct my points to the new Janssen vaccine, and then talk about the importance of second dose vaccine for both the Pfizer and Moderna vaccines. So in regards to the Janssen vaccine, this is a vaccine that has been proven to be very safe and highly effective for preventing serious illness and hospitalizations, in addition to preventing illness. The data for this vaccine is not comparable to other vaccines. Vaccines can only be compared in head-to-head clinical trials, which did not occur. The Janssen vaccine was found to be 89% effective at preventing severe disease, and in trial, 100% effective at preventing death. All of the authorized vaccines are more than 50% effective in preventing COVID-19 infection. A vaccine with at least 50% efficacy is found to have a significant impact on disease, both for the individual receiving that vaccine as well as at the community level. Of note is that the Janssen vaccine can be a good option for those individuals and groups that may not come back for a second dose. Again, the important differentiation between the Janssen vaccine and the other two vaccines we currently have is that the Janssen vaccine is a single dose vaccine, whereas the other two that we currently have are required two doses. Now, the decisions on how best to use the Janssen vaccine will be based on how many doses will be available to us and the allotments that we actually receive. What is most important, however, is that we can't emphasize enough is that all three vaccines that are currently authorized for use have been found to be safe and effective. the best vaccine for someone to get is the one that is available to them. Now, a little bit about the importance of second doses for both the Moderna and Pfizer vaccine. If people do get the Pfizer or the Moderna vaccine, it is very important for them to get their second dose within the recommended timeframes and to receive the vaccine that was given to them for the first dose. So in other words, if your first dose was a Pfizer vaccine, you need to get your second dose with the same vaccine. The first dose of the vaccine starts building protection from the virus that causes COVID-19. The second dose is needed to get the most protection the vaccine has to offer. Where there has been information that first doses can provide a higher level of protection, there is yet not enough information to say how long that protection will last without the second dose. People may also be hesitant to get the second dose of the vaccine because they hear the side effects may be more pronounced. Some people do experience more side effects after the second shot. However, these are normal signs that your body is building an immune response against the virus. The most commonly reported side effects include pain at the injection site, fever, chills, tiredness, or a headache, and these symptoms typically resolve within a day or two. And lastly, second dose appointments are available on our website for those who were vaccinated at one of our clinics, and we urge people to make an appointment if they have not done so already. Thank you.
Good afternoon, everyone. Very happy that so many of you could make it today and that we could share this information. We're really excited about the new Janssen vaccine coming out, and that just gives us another opportunity to have more doses of vaccine in Nevada so that we can get it out to the public. If we have been having a couple of questions from providers, from healthcare providers, on how to get that vaccine to give it to their patients and individuals, and they can apply through the state. And we have on our website on the top where we have the landing page for the COVID vaccine. It says for healthcare providers, and if they go to that site, then they can find out how to apply for vaccine delivery. I think that's all I have, and we're really excited that we could also have we have a lot of appointments yet at Las Vegas Convention Center and Cashman. They're both doing first and second doses, and we do have a lot of availability, as well as a lot of our partners, UNLV, UMC, North Las Vegas. And so please take advantage of the appointments available at this point. Thank you.
At this time, we will open it up for questions from the media. One question per person. Raise your hand and we will take them in the order received. Our first question today is from Jaclyn Schultz from Fox 5.
Hi, everyone. Good afternoon. Got off the COVID-19 task force call, and they said within the next couple weeks, hospitality workers are going to be up, hopefully. And is there any plans to create another pop-up site like Encore, or direct them there, or have them go to the current mega sites that we do have? Any insight for that particular group would be appreciated.
So this is Greg Castle with the incident management team at the Health District. Our plan right now is to increase capacity at our current operating sites. Personnel is always a challenge, and to break off and set up additional testing locations pulls away our capabilities at other spots. So we want to maintain the high volume that we're doing. We need to ramp up even more. So we're making some adjustments in our scheduling right now. So we also have more discussions next week when we'll meet more with the state and some of the gaming control board officials that are tasked with getting this out. But right now, our plan is to just boost our opportunities at the mega sites to facilitate as many people as we can.
Next up today is Mr. Joe Moeller. Go ahead.
Yeah, hi there. Joe Moeller here from Channel 8 here in Las Vegas. I have a two-part question, I guess you could say here. With the the vaccine, the Johnson & Johnson vaccine, which is it, first clarification, Janssen or Johnson or Janssen for that? I've heard of Janssen. I want to make sure we're saying it right. And for that vaccine, how are we doing with that when it comes to shipments? How many have come to Southern Nevada? I know someone mentioned that, something on that, but I didn't really understand what they said. Do we have it already here in Southern Nevada? Is it being used? What's the plan in the coming weeks? Because I think there might be a little bit of a delay. What's the plan with that? And will those be at certain locations only, such as pharmacies or something like that? Because it is only a single time and it doesn't need to be.
Right. I'm not sure about the pronunciation. Janssen sounds good to me. But we are expecting a rather large shipment from around 17,000 doses for the first week. However, that may go down significantly in the next week or two. We're just not sure. So right now we've asked the healthcare providers that do provide vaccine what their request is, and we will attempt to fulfill those requests for them. So some of the hospitals have requested the vaccine for patients that are discharged, for example. We've had some healthcare providers also request the vaccine, and then we're still in the planning phase of what we would do with the vaccine, but we probably will just offer it just like we do any other vaccine at our clinics. We have not received it yet as of today.
Excuse me. Next question is from Alexis Goree. Please go ahead.
Hello. My question is about appointments. We see that obviously there's a new pool of eligible Nevadans who can get the vaccine, and there are an abundance of appointments available, obviously opposite from when we first started distributing vaccines. Why may that be? Are there just more appointments or less people less interested in getting the vaccine? What has changed?
Well, I can take that question, sure. Well, some of the issues are that we have caught up with some of our second dose vaccines, so that may be a factor. We also moved to a different format, a different platform. So it has been easier for people to cancel appointments and for them to manage them. We've also, there might be some other reasons. Maybe people are waiting for the Janssen vaccine to come out. I don't know. And we did open it up, and one of the considerations was that we had open appointments. So it could be a number of all those factors, but we're really hoping that people will really take advantage of the open appointments and and get in and get their vaccine.
I would like to add on to that, Joanne, if I can. One of the other issues that opened up some space was we had almost 11,000 double bookings and triple bookings from people just booking appointments randomly. And our partners with FEMA that are in town, providing extra staffing and assistance to us, they made just under 11,000 phone calls over the last few weeks to make contact with these people and say, are you coming in for your shot? If you do need an appointment, and if you've got multiple appointments, let's cancel them. So they did a lot of hard work on the ground level there to clear up a lot of appointments and get people headed in the right direction. So all those factors that Joanne mentioned, plus that one, are the reason we have some more spaces open.
Our next question today is from Michael Davidson.
Hello, everybody. The health district produces weekly vaccine reports, just capturing a bunch of different data about who is getting the vaccine, inventory, that sort of stuff. I just had a quick question about with the introduction of a new vaccine that is only one dose instead of 2 doses, how should we expect to see those reports be updated? I'm just wondering, for us giving that information to our readers, are there any big changes to those reports we should expect in this week or in the coming weeks because of the fact we've now got a 1-dose vaccine that's being administered alongside 2-dose vaccines?
I would think that we would not change it that much. We would just add on the information about the Johnson vaccine and the number of given. One thing that it will make a difference is that people will complete their series on the first dose. So we might have more of a completion percentage for the vaccine that we give out right now.
Thank you. Our next question today is from Ms. Hillary Davis.
Hi, how many of the appointment no-shows have been for second doses? It sounds like in these last few meetings you have mentioned no-shows being for first doses as people appointment shop or whatnot. So how many of those no-shows have been for second doses, and how are you ensuring that people are making their second doses?
So I'll take that question. It's Greg Castle. A lot of those second doses we're like around 36% of the people not coming back for their second vaccines. A wide range of issues. I'm sure some of them were they triple booked appointments and they caught a second dose at another time, and so it showed they were coming in for another appointment and they didn't show up, or they got it at another location. And what was the second part of your question? I should have wrote that down.
Hang on, let me find her. And
What we're doing to ensure the vaccine.
Beginning over a month ago, we transitioned to a point technology-wise where we were able to schedule second appointments when you got your first appointment. So before that, we had some struggles with that, which caused us some issues. We've now resolved that. We're to the point we're at the 1 month mark right now. So everybody a month ago that got a first dose before they left the site, we're able to schedule their second appointment. So we've shored that up on our end, and we anticipate that solving some of those problems for us on both the scheduling and the people showing up.
Our next question today is from Mary Hines. Mary, you're unmuted whenever you're ready.
Okay, can you hear me now?
Mm-hmm.
Thank you. What is your best estimate of how long it will take to get through the entire frontline supply chain and logistics group? 2 weeks, 2 months? Looking for an estimate on that. I know, as you said, you have an abundance of appointments now. What are you thinking?
Well, it's Greg Castle again. I would say our best estimate to get through that group is I really don't have a great estimate, right? It depends on how many people show up, how many people actually want it. If there's, say, 100,000 people coming in that are eligible in that new group, and I don't know if that's an accurate number or not, but I'm just using it as an example, and everybody wanted it, it would take us several months to get through that. But if there's only half of that, it would obviously be quicker. So I would say the best guess, it would be roughly a month with the amount of people that have been coming in the other groups. I'm not sure if this group will be more inclined to get it as opposed to other groups that have been opened up before. We opened up from 70 to 65 because we were 70, or that group, the 70s, and other occupational groups that were open at the time, were not filling our vaccine sites. So we had to make some quick moves in the last couple of weeks to get as many people eligible as we could to get them into the seats. So I can't give you a hard estimate on that, but I would say it would be, several weeks at the very earliest, given how many people come in and actually participate.
Okay, it looks like that's going to be the end of our questions today. Does anybody have anything before we wrap up? Okay, seeing none, and we don't have a Spanish portion today. If anybody has follow-up questions, please send those to the office communications. Otherwise, that's it for today, and we will see you all next week.
You've been watching Breaking News from the Las Vegas Review-Journal, sponsored by Michael